Today sees the launch of the latest World Health Organization report. This document is perhaps the most important publication ever produced in relation to the profession of nursing. The State of the World Nursing Report is the product of collaboration at global, regional and national levels. Countries have worked with professional organisations, regulators, educators and others to capture the information documented, analysed and presented in this important publication. This short presentation provides some basic information on the document that I hope will encourage you to access and reflect on the entire content. The World Health Organization, along with the International Council of Nurses, the International Confederation of Midwives, the Nursing Now campaign and a range of other individuals and organisations have been working to prepare two specific reports. The first, the State of the World Nursing Report, is launched today. The second, the third State of the World Midwifery Report, will be launched next year. These reports are published within the context of the bicentennial anniversary of Florence Nightingale's birth and the World Health Organization designation of 2020 as the International Year of the Nurse and Midwife. Furthermore, these documents are being published at a particular auspicious time as we enter the last decade of progress towards pursuit and achievement of the Sustainable Development Goals. The State of the World Nursing Report is available on the World Health Organization website and consists of three distinct resources. First, there is a summary document that captures the main recommendations and provides a flavour of the data obtained to inform this important policy document. Second, the main report sets the scene by focusing on how nursing can assist in the pursuit of the Sustainable Development Goals and the achievement of universal health coverage. It explores nursing's roles in the 21st century and identifies policy levers and clearly documents the current state of evidence in terms of the numbers, education, regulation and governance of the profession. Having identified the opportunities and reported the evidence, future direction is set and conclusions are reached. This report provides aggregate information at global and regional levels. However, detailed country-specific data is also available as a web resource. It is important to recognise the report captures information on nursing professionals, the registered nurse cohort, and nursing associates, those that are often referred to as vocational or practical nurses. It does not, however, provide information on support workers that often complement nursing care delivery teams. As mentioned earlier, the report uses the Sustainable Development Goals as a framework for exploring nursing contribution. In particular, it focuses on SDG 3, good health and well-being, SDG 4, quality education, SDG 5, gender equality, and SDG 8, decent work and economic growth. It is, however, important to note that whilst the focus is on these 4 SDGs, nursing can contribute through action, advocacy or alignment with all 17 goals. Considerable focus is given to the pursuit of universal health coverage. Nursing is viewed as being essential to expanding population coverage, enhancing financial risk protection, and ensuring the delivery of a package of essential services. The pursuit of all of these elements require a number of fundamental changes, and these are captured in the 10 recommendations in the report. In this presentation, there is insufficient time to explore each of these recommendations in detail. However, each of the 10 recommendations can sit within a simple 4-dimensional model. Education will be key in informing many of the changes. Professional practice, regulation and socioeconomic welfare will interact in the generation and delivery of solutions, and each of the 10 recommendations can be accommodated easily within this framework. It is not to say that the location of these recommendations is dominated by any one of these 4 dimensions, but rather it's a starting point for collaborative success. Later this year, NCSBN will explore in detail the regulatory implications of this report at its Delegate Assembly. Regulation has a critical role to play in the pursuit of the Sustainable Development Goals and the attainment of universal health coverage. Nursing is by far the largest health profession, has a major contribution to make, and needs to be central to the policy development process. The goal for all of us is to build upon the evidence presented in this report and pursue solutions that are fit not only for today's challenges, but for those of the future. I encourage you all to visit and access this important publication, and if you have any questions or comments, please don't hesitate to contact me, as I'd be delighted to enter into dialogue that will help advance the contribution that the profession can and must make in the years ahead.